Hello, can you hear me? Yes. It's okay? I'm Daniel, I am working for ED in France, and it is my first public presentation. And and I'm French and I have to do this in English. Oh God. So, we have an E-PrEP project, so we are trying to create a digital access to PrEP with e-consultations and e-community counselling in Centre Val de Loire in France. How does it work? Okay. A few words about ED, and then why do we want E-PrEP, how do we want to do this, and the perspectives and questions we have. So ED is a French association. It's a community-based and driven association. We are fighting against HIV and hepatitis, and we are a member of Coalition Plus. In 2008, we were more than 2,200 activists, including 500 staffs. We are present in the 76 centers in France and French Caribbean islands, and we made more than 30,000 actions of support and prevention. We distributed 1 million condoms, 1.8 million syringes. We made 42,000 rapid tests and have given 6,500 HIV self-tests. We are doing PrEP counseling, so we made almost 3,000 community counselings for more than 2,000 people. The people were, the average was 36-year-old. 92% are MSM. 36% of them have sham sex. More than 50% have group sex. And 4% have sex in exchange for money or drugs. So E-PrEP, why? The region is in the center of France, as you can see it. We have two big cities, which are Tours and Orléans. Otherwise, we have smaller cities and a lot of villages. So it is a rural or semi-rural region. We don't have lots of doctors, so there is a high medical desertification in our region. And we have a high hidden HIV epidemic. We have 900 people who don't know they are HIV positive, so we are second behind the Paris region. How can you get PrEP in Centre Val de Loire? You can get PrEP in Centre Val de Loire in STI clinics. There are the black points. So, and we are in providing community counseling in nearly all STI clinics. And the PrEP renewal and follow-up is possible with family doctors, but in fact, it doesn't work. So we have lots of barriers to access on PrEP. Of course, we have the access, as you can see, is limited to the large urban areas. So if you live here or here, you have to do 50 or 100 kilometers to get PrEP. There is, of course, ignorance about PrEP in the communities and in the medical staff. The appointments in the STI clinics can be weeks or months. And there is fear of judgment and stigmatization from the medical staff and from within the communities. But we do have internet in Centre Val de Loire. As you know, Internet is used by MSM for sexual meetings. So, I'm on Grindr. Internet is also used by sex workers, but the female sex workers use it through ads with their numbers. So we thought that we could try to get PrEP through internet, and we are trying to proposing a digital access to PrEP in an experiment from 2020 to 2022. How do we do that? We have first to be digitally connected with people. So our targets are MSM and sex workers. We have first selected the most used websites and apps. You mostly know them. And we use them and geotag in small and medium towns, not in the big cities, on the website and apps we have selected. So we have started last year, and we have the, you can see on the card, oh, it's not a good button. Voilà. Before PrEP is here, 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 and here, and after, if we propose E-PrEP on the people who are connected, we can potentially touch everybody in the region. We started in the MSM sex workers websites. The MSM sex workers are online, so it is easy. We made, from January to June of this year, 78 e-sessions, and we had more than 1,500 e-contacts. It's more difficult with the female sex workers because they are not online. So we had 5 call sessions and 50 phone and SMS contacts. Once we are in contact with the people, we can propose them e-counseling on sexual health. So we are 5 salaried and 6 volunteers in the region who are doing a community-based e-counseling. And for the e-counseling, we switch to tools adjusted to the e-interviews. We switch to, for example, Gruveo, which is a tool which is simple to use. There is no app installation and no account creation. We also use WhatsApp, Skype, Messenger, and of course phone. And we will use a tool called CARE for the E-PrEP. So from January to June, we had more than 300 e-counselings, mostly with MSM, and we are proposing prevention and harm reduction, testing and health exams, vaccination, sayability, medical follow-up, access to rights. We also propose to send them condoms, lubes, sniff and injection preventing materials, and HIV self-tests. And we will, in next year, propose to order online these materials. So how do we have chosen CARE? CARE is a medical consultation platform, and it's interesting because it's very innovating. We will have a dedicated page on E-PrEP, and it will be free for the people. The access for people with a smartphone will be very easy. The e-consultation and the e-counseling are secured. With CARE, we can manage the schedule of the practitioners and the community counselors. With CARE, we can have prescription dispatching, SMS reminders. We can consolidate the biological results, and there is a possibility to dispatch medicine, so we can send PrEP to people if they need it. And it is a moderated cost for our structure, but the use of care needs to have an adapted network and hardware. So we will start E-PrEP on care in January, so in 3 months. And we have some questions. For example, the biological results upstream the PrEP prescription will be done in local laboratories, but we can think about an auto-taking at home. So if we think about auto-taking at home, we can also think about a digital access for the testing of all STIs. And this is a new project we are thinking about called E-Depist. The other questions we have is, we are 11 to do this project, and then the question is how to cope with rising demand and lack of human resources. We think that people will navigate their PrEP pathway physically and digitally. And it's okay, because the idea is that the pathway goes like people want to have PrEP. We are sure that it will work with MSM, because we have a list of MSM who are waiting for the digital access on PrEP, but we don't know if it works with sex workers. We think it will be more difficult because the female sex workers are not online. And when will this new modality of action scale up to all the ED network? We are doing this locally in Centre-Val de Loire, but all France can be interested in. So thank you for your attention.